Cardiovascular diseases, often abbreviated as CVD, represent a broad category of conditions that affect the heart and blood vessels. These are not just single ailments, but a collection of problems that can impact the body's entire circulatory system. Think of this system as the body's intricate highway network, with the heart acting as the central, powerful engine. When parts of this network become damaged or blocked, the consequences can be serious and widespread. These conditions include well-known problems like coronary artery disease, which involves narrowed arteries and high blood pressure, also known as hypertension. They also encompass heart failure, stroke, and congenital heart defects, which are present from birth. Understanding this group of diseases is the first step toward effective management and care. The scope of cardiovascular diseases is vast, touching millions of lives across the globe and standing as a leading cause of morbidity and mortality. For the family nurse practitioner, this is not just a chapter in a textbook. It is a daily reality in clinical practice. Patients of all ages, from young adults with genetic predispositions to older adults with multiple chronic conditions, will present with issues related to their cardiovascular health. The complexity of these diseases requires a deep and nuanced understanding. It is about recognizing the subtle signs of a developing problem, knowing the risk factors that contribute to disease progression, and implementing evidence-based strategies to improve patient outcomes and quality of life. At its core, most cardiovascular disease is linked to a process called atherosclerosis. This is a condition where plaque, a substance made of fat, cholesterol, calcium, and other materials, builds up inside the arteries. Imagine the pipes in a house slowly becoming clogged over many years. This is similar to what happens in the blood vessels. This buildup makes the arteries narrower, which can reduce or even block the flow of oxygen-rich blood to vital organs, including the heart and brain. When a plaque deposit ruptures, it can trigger the formation of a blood clot, leading to a sudden and life-threatening event like a heart attack or stroke. This underlying mechanism is a key concept for family nurse practitioners to master. Therefore, as we begin this discussion, it is essential to frame cardiovascular disease not as an insurmountable challenge, but as a manageable set of conditions. With the right knowledge and skills, family nurse practitioners can play a pivotal role in changing the trajectory of these diseases for their patients. This essay will explore the essential aspects of CVD that are critical for family nurse practitioner exam success, and more importantly, for competent and compassionate clinical practice. We will delve into diagnosis, treatment, patient education, and the guidelines that shape modern cardiovascular care, providing a comprehensive overview for the aspiring and practicing family nurse practitioner. The importance of cardiovascular disease knowledge for a family nurse practitioner cannot be overstated. Family nurse practitioners are often the first point of contact for patients within the healthcare system, placing them in a unique and powerful position for early detection and intervention. Patients will present to primary care for routine physicals, management of other chronic illnesses, or acute complaints that may, on the surface, seem unrelated to the heart. It is the astute family nurse practitioner who can connect the dots between a patient's complaint of fatigue or shortness of breath and a potential underlying cardiac issue. This frontline role means that a deep understanding of cardiovascular disease is not just beneficial. It is a fundamental requirement for providing safe and effective patient care across the lifespan. Beyond initial detection, family nurse practitioners are central to the long-term management of patients living with chronic cardiovascular conditions. Managing diseases like hypertension, hyperlipidemia, and heart failure is a continuous process that requires ongoing monitoring, medication adjustments, and patient support. This is the very essence of primary care. The family nurse practitioner builds a trusting, long-term relationship with the patient, which is crucial for adherence to treatment plans. This partnership allows the family nurse practitioner to tailor care to the individual's lifestyle, cultural background, and personal health goals, making the management plan more realistic and sustainable. The family nurse practitioner acts as a consistent guide on the patient's long journey with chronic disease. Furthermore, the family nurse practitioner's role extends into the realm of prevention, which is arguably the most impactful aspect of cardiovascular care. By identifying and addressing risk factors early, family nurse practitioners can help patients avoid the devastating consequences of a major cardiac event. This involves screening for high blood pressure, checking cholesterol levels, discussing smoking cessation, and providing counseling on diet and exercise. This proactive approach is a cornerstone of the family nurse practitioner philosophy. It is about shifting the focus from simply treating sickness to actively promoting wellness and preventing disease before it takes hold, thereby reducing the overall burden of cardiovascular disease on individuals, families, and the healthcare system as a whole. Finally, family nurse practitioners serve as crucial coordinators of care, especially for patients with complex cardiovascular needs. They collaborate with a wide range of specialists, including cardiologists, endocrinologists, and dietitians, to ensure the patient receives comprehensive, integrated care. The family nurse practitioner often acts as the central hub, synthesizing information from various sources and translating it into a coherent and understandable plan for the patient. This communication and coordination are vital for preventing medication errors, avoiding redundant tests, and ensuring that all members of the healthcare team are working together toward the same goals. This leadership role highlights the family nurse practitioner's integral place within the modern healthcare landscape. The journey to diagnosing a cardiovascular disease begins with the most fundamental skill in medicine, listening to the patient. A thorough and detailed health history is the cornerstone upon which all further diagnostic steps are built. The family nurse practitioner must be an expert investigator, asking targeted questions to uncover clues about the patient's condition. This includes exploring the chief complaint in detail, using the classic PQRST mnemonic: provocation, quality, radiation, severity, timing, for symptoms like chest pain. It is also critical to inquire about associated symptoms, such as shortness of breath, dizziness, swelling in the legs, or heart palpitations. A comprehensive review of systems can reveal subtle signs that the patient may not have thought to mention. Equally important to the history of the present illness is a deep dive into the patient's past medical history, family history, and social history. The family nurse practitioner needs to know about pre-existing conditions like diabetes, kidney disease, or autoimmune disorders that can impact cardiovascular health. A detailed family history is crucial, as many heart conditions, including certain arrhythmias and cardiomyopathies, have a strong genetic component. The social history provides invaluable information about lifestyle-related risk factors. This includes asking specific, non-judgmental questions about media group, nurse asking patient about smoking, alcohol, diet, or exercise, healthcare professional recording lifestyle details at stock at distribute_equally, tobacco use, alcohol consumption, diet, physical activity levels, and even the patient's stress levels and support systems, all of which are major contributors to cardiovascular risk. Following the history, a meticulous physical examination is performed to find objective evidence that supports or refutes the suspected diagnosis. This starts with the vital signs, which are a quick and powerful snapshot of cardiovascular function. Measuring blood pressure accurately, assessing heart rate and rhythm, and checking the respiratory rate are all essential first steps. The examination then proceeds with a focused cardiovascular assessment, including media group, nurse inspecting patient's legs for edema, nurse examining patient for cyanosis at stock at distribute_equally, inspection for cyanosis or edema, palpation for the point of maximal impulse and peripheral pulses, and, critically, auscultation. Listening carefully to the heart for murmurs, gallops, or rubs, and to the lungs for crackles, can provide direct evidence of cardiac dysfunction. The synthesis of information from the history and physical exam allows the family nurse practitioner to form a differential diagnosis, a list of the most likely conditions causing the patient's symptoms. This crucial step guides the selection of appropriate diagnostic tests. For example, a patient with exertional chest pain and a strong family history of heart disease would warrant a different workup than a young patient with palpitations and a normal physical exam. This clinical reasoning process, which links the patient's story and physical findings to a logical diagnostic plan, is a hallmark of an expert family nurse practitioner. It ensures that testing is purposeful, cost-effective, and targeted toward answering specific clinical questions. Once the initial assessment points toward a potential cardiovascular issue, the family nurse practitioner utilizes a range of diagnostic tools to confirm the diagnosis and assess its severity. Among the most common and fundamental tests is the electrocardiogram, or ECG. This simple, non-invasive test records the electrical activity of the heart, An ECG can provide immediate and valuable information about the heart's rate and rhythm, and it can detect signs of an acute myocardial infarction, previous heart muscle damage, or cardiac chamber enlargement. For the family nurse practitioner, being able to interpret the basic findings of an ECG is an essential skill for making timely and critical clinical decisions in the primary care setting. Laboratory tests are another pillar of cardiovascular diagnostics. A standard lipid panel which measures total cholesterol, LDL or bad cholesterol, HDL or good cholesterol, and triglycerides is fundamental for assessing a patient's risk for atherosclerotic disease. Other important blood tests include markers of cardiac muscle injury, such as troponin, which is highly specific for a heart attack. Basic metabolic panels are also crucial, as they assess kidney function and electrolyte levels, which can be affected by cardiovascular disease and the medications used to treat it. The family nurse practitioner uses these lab values not only for diagnosis, but also for monitoring the effectiveness and safety of treatment over time. For a more dynamic assessment of the heart's function, especially when symptoms are intermittent or occur with exertion, the family nurse practitioner may order further testing. An ambulatory ECG monitor, such as a Holter monitor worn for 1 to 2 days, or an event monitor worn for longer periods, can capture rhythm disturbances that might be missed on a standard 12-second ECG. A stress test is another key diagnostic tool, where the patient exercises on a treadmill or stationary bike while their ECG and blood pressure are monitored. This helps to determine if there is reduced blood flow to the heart muscle during physical stress, which is a hallmark sign of significant coronary artery disease. In situations where a more detailed view of the heart's structure and function is needed, imaging studies are employed. The echocardiogram, which uses ultrasound waves to create a moving picture of the heart, is one of the most powerful and frequently used imaging tests in cardiology. It can assess the size and shape of the heart, the pumping strength of the ventricles, and the function of the heart valves. This detailed information is invaluable for diagnosing conditions like heart failure, valvular heart disease, and cardiomyopathy. The family nurse practitioner must know when to order these advanced tests and how to interpret the reports to guide patient management. So, pharmacology is honestly a cornerstone of modern cardiovascular disease management, and the family nurse practitioner really needs to have a firm grasp of the major drug classes used to treat these conditions. For hypertension, the first-line agents often include thiazide diuretics, AC inhibitors, angiotensin II receptor blockers, also called ARBs, and calcium channel blockers. Each class works through a different mechanism to lower blood pressure, and the choice of medication is, well, often tailored to the patient's specific comorbidities, such as diabetes or kidney disease. For example, ACE inhibitors and ARBs are particularly beneficial for patients with diabetes because they offer protective effects for the kidneys. Understanding these nuances is critical for safe and effective prescribing. When it comes to managing high cholesterol or hyperlipidemia, statins are, without a doubt, the undisputed workhorses. These medications are highly effective at lowering LDL cholesterol, which is the primary driver of atherosclerotic plaque buildup. Statins work by inhibiting a key enzyme in the liver's cholesterol production pathway. While they are generally safe and well tolerated, the FNP must be knowledgeable about potential side effects, such as muscle pain, myalgia, and know how to monitor liver enzymes. For patients who cannot tolerate statins or who need additional LDL lowering, other medications like ezetimibe or PCSK9 inhibitors may be considered, often in consultation with a cardiology specialist. In the management of coronary artery disease and the prevention of heart attacks, antiplatelet agents play a vital role. Low-dose aspirin is commonly recommended for secondary prevention in patients who have already had a cardiovascular event. It works by making platelets less sticky, thereby reducing the risk of a blood clot forming on a ruptured plaque. Other potent antiplatelet medications, such as clopidogrel, are often used in combination with aspirin, especially after a coronary stent has been placed. The FNP must carefully weigh the anti-clotting benefits of these drugs against the increased risk of bleeding, making individualized decisions for each patient. For patients with heart failure, the pharmacological regimen is often complex and involves multiple medications aimed at improving symptoms and prolonging life. This typically includes a combination of an ACE inhibitor or ARB, a beta blocker, and sometimes a diuretic to manage fluid retention. Newer classes of drugs, such as angiotensin receptor neprilysin inhibitors, ARNIS, and SGLT2 inhibitors, which were originally developed for diabetes, have shown remarkable benefits in heart failure and are now integral to treatment guidelines. Managing these complex medication cocktails really requires meticulous attention to detail, frequent monitoring of labs and vital signs, and of course, excellent patient education by the FNP. While medications are powerful tools, the true foundation of preventing and managing cardiovascular disease lies in lifestyle modification. The family nurse practitioner's role as a health coach and educator is paramount in this domain. One of the most critical interventions is promoting a heart-healthy diet. This is not about restrictive or temporary fad diets, but about instilling sustainable eating patterns. The FNP should guide patients toward diets rich in fruits, vegetables, whole grains, and lean proteins, such as fish and poultry. The DASH, or Dietary Approaches to Stop Hypertension, diet and the Mediterranean diet are excellent evidence-based models to recommend, as they emphasize these components while limiting sodium, saturated fats, and processed foods. Regular physical activity is another non-negotiable component of cardiovascular health. The benefits are numerous. It helps lower blood pressure, improves cholesterol levels, aids in weight management, and strengthens the heart muscle. The FNP should encourage patients to aim for at least 150 minutes of moderate-intensity aerobic exercise, such as brisk walking, swimming, or cycling, per week. It is important to help patients find activities they genuinely enjoy to increase long-term adherence. For individuals who are sedentary, the key is to start low and go slow, gradually increasing the duration and intensity of exercise to avoid injury and build confidence. Tobacco cessation is arguably the single most important lifestyle change a person can make for their heart health. Smoking damages the lining of the blood vessels, increases blood pressure, and reduces the amount of oxygen in the blood. The FNP must adopt a supportive and non-judgmental approach, consistently asking about tobacco use and offering assistance at every visit. This includes providing counseling on behavioral strategies and prescribing evidence-based cessation aids, such as nicotine replacement therapy, patches or gum, or medications like varenicline or bupropion. Every attempt to quit should be viewed as a success, and the FNP's persistent encouragement can make all the difference. Finally, the FNP must address other crucial lifestyle factors, including achieving and maintaining a healthy weight, limiting alcohol consumption, and managing stress. Even modest weight loss of 5 to 10% of body weight can significantly improve blood pressure, blood sugar, and cholesterol levels. Providing guidance on portion control and mindful eating can be very effective. Similarly, counseling patients on the recommended limits for alcohol intake and exploring healthy stress reduction techniques such as mindfulness, yoga, or simple hobbies can have a profound impact on overall cardiovascular well-being. These lifestyle conversations are a continuous dialogue, not a one-time lecture. To provide the highest standard of care, family nurse practitioners must base their clinical decisions on the most current, evidence-based guidelines. For cardiovascular disease, the most influential guidelines in the United States are published by organizations like the American Heart Association and the American College of Cardiology. These documents are the culmination of rigorous reviews of scientific research and provide specific recommendations for the prevention, diagnosis, and management of conditions like hypertension, hyperlipidemia, and coronary artery disease. Staying updated on these guidelines is not just good practice. It is an ethical obligation to patients and a key component of preparing for the FNP certification exam. The 2017 ACC and AHA Guideline for the Prevention, Detection, Evaluation, and Management of High Blood Pressure in Adults, for example, fundamentally changed how hypertension is defined and treated. It lowered the threshold for stage 1 hypertension to a blood pressure of 130/80, emphasizing the importance of earlier intervention. The guidelines provide a clear roadmap for when to initiate lifestyle modifications alone and when to add antihypertensive medication. They also offer specific recommendations for medication choices based on patient demographics and comorbidities. The FNP must be intimately familiar with these thresholds and treatment algorithms to manage hypertension effectively in the primary care setting. Similarly, the guidelines on the management of blood cholesterol provide a framework for assessing atherosclerotic cardiovascular disease risk. Instead of treating to a specific LDL cholesterol target number, The modern approach focuses on prescribing the appropriate intensity of statin therapy based on a patient's 10-year ASCVD risk score. This score is calculated using factors like age, sex, race, cholesterol levels, blood pressure, and smoking status. The guidelines categorize patients into risk groups and recommend high-intensity, moderate-intensity, or low-intensity statin therapy accordingly. An FNP must be proficient in calculating this risk score and using it to guide shared decision-making with the patient. Navigating these guidelines requires more than just memorization. It requires clinical judgment. Guidelines provide a roadmap, but the FNP must always consider the individual patient sitting in front of them. This includes factoring in patient preferences, potential barriers to care, medication costs, and quality of life. The principle of shared decision-making, which is heavily emphasized in all modern guidelines, means the FNP must be able to explain the risks and benefits of different treatment options in plain language. This empowers the patient to be an active partner in their own care, leading to better adherence and outcomes. Mastering the guidelines means knowing how to apply them wisely and compassionately. Effective patient education is the bridge between a clinical diagnosis and a successful long-term outcome. For the family nurse practitioner, teaching is as important a skill as diagnosing. When it comes to cardiovascular disease, education must be clear, simple, and actionable. Avoid using complex medical jargon. Instead of saying hypertension, say high blood pressure. Instead of atherosclerosis, explain it as plaque buildup that clogs your arteries. Using analogies, like comparing clogged arteries to clogged pipes in a house, can make abstract concepts more concrete and understandable for patients. Providing simple written materials or directing patients to reputable websites can also reinforce the key messages discussed during the visit. A crucial aspect of patient education is teaching self-monitoring skills. For a patient with hypertension, this means teaching them how to correctly measure their own blood pressure at home. The FNP should explain the importance of using a validated, automated cuff-style monitor on the upper arm and provide guidance on when and how often to check their pressure. Patients should be given a simple log to record their readings, which they can bring to their appointments. This not only provides valuable data for medication management, but also actively engages the patient in their own care, fostering a sense of control and responsibility for their health. Prevention is the ultimate goal, and the FNP's educational efforts should heavily focus on this. This involves having proactive conversations about risk factors, even with healthy patients during their annual wellness visits. A simple but powerful educational tool is explaining the concept of knowing your numbers. Encourage patients to know their blood pressure, cholesterol levels, blood sugar, and body mass index. Frame these numbers not as grades or judgments, but as important pieces of information about their health, similar to knowing the mileage on their car. This simple framework can motivate patients to be more engaged in routine checkups and screenings. Finally, patient education must be a continuous conversation that addresses both prevention and management. For patients already diagnosed with a heart condition, education should focus on the importance of medication adherence, recognizing warning signs of a worsening condition, and knowing when to seek urgent medical care. For example, a patient with heart failure should be taught to weigh themselves daily and to call the clinic if they notice a sudden weight gain, which could indicate fluid retention. By empowering patients with this knowledge, the FNP transforms them from passive recipients of care into active, informed partners in managing their health and preventing future complications. In conclusion, a comprehensive mastery of cardiovascular diseases is not merely an academic exercise for passing the FNP exam. It is the bedrock of competent, compassionate, and effective primary care. Throughout this essay, we have journeyed from the basic definition of cardiovascular disease to the intricate details of diagnosis, treatment, and patient empowerment. We have seen that these conditions, while common and serious, are often preventable and manageable with the right approach. The family nurse practitioner is uniquely positioned at the forefront of this effort, serving as a diagnostician, a manager of chronic illness, a health coach, and a coordinator of care. This multifaceted role requires a deep and enduring commitment to lifelong learning. The skills required to manage cardiovascular health are a microcosm of the FNP role itself. It demands a strong foundation in pathophysiology and pharmacology, coupled with the art of communication and patient education. It requires the ability to interpret diagnostic tests and synthesize complex information, but also the wisdom to listen intently to a patient's story and understand their individual circumstances. The FNP who excels in cardiovascular care is one who can seamlessly integrate the science of evidence-based guidelines with the humanistic art of building a trusting therapeutic relationship. This synthesis is what leads to improved patient outcomes and a reduction in the burden of heart disease. As you prepare for your FNP certification exam and your future practice, remember the profound impact you can have on the cardiovascular health of your patients and your community. Each time you accurately diagnose hypertension in a previously unaware patient, you prevent a potential stroke. Each time you successfully counsel a patient to quit smoking, you add years to their life. Each time you patiently explain a medication regimen to a patient with heart failure, you improve their quality of life and reduce their risk of hospitalization. These are not small victories. They are the very essence of why the FNP role is so vital. Therefore, embrace the challenge of mastering this critical subject. View every patient encounter as an opportunity to screen for risk, to educate about prevention, and to optimize management. The knowledge you gain will empower you to practice with confidence and to make a tangible difference in the lives of countless individuals. The heart of the matter is this: your expertise in cardiovascular disease will be one of the most powerful tools you possess as a family nurse practitioner, enabling you to protect the health and well-being of your patients for years to come.